Hello everyone. Today we are going to explore a fascinating clinical application of biochemistry, and that is enzymes as therapeutic agents. Enzymes are not just molecules that speed up reactions in the body. They can also be used as a powerful medicines to treat various diseases. From dissolving dangerous blood clots to fighting cancers, enzymes have a big impact in modern medicine. Let's understand how these biological catalysts work as therapeutic agents. The first major clinical application we will discuss is enzyme as thrombolytic agents. Now, what does thrombolytic means? It means clot dissolving. Let's understand why this is important. In the body, there is a natural blood clotting process. This process involves a cascade of enzymatic events, that is, a series of enzymatic reactions happening one after another. This cascade ultimately leads to the conversion of a protein called fibrinogen into fibrin, which forms the actual clot. Now, while clot is essential to stop bleeding, sometimes clot form inside the blood vessels where they shouldn't, and this is called thrombosis. When thrombosis occurs in an artery, it can completely block the artery and stop blood supply to the tissue. Without blood supply, that tissue does not get oxygen and nutrients, leading to tissue death or infarction. The most common and serious example of this is myocardial infarction, commonly known as heart attack, where a clot blocks blood supply to heart muscle. So the question is, how do we dissolve these dangerous clots? This is where the body's natural clot dissolving system comes in. There is a plasma protein called plasminogen. Think of plasminogen as an inactive precursor like a sleeping enzyme. When activated, it converts to plasmin, which is the active form. Now, plasmin is a powerful enzyme that can digest fibrin and break down the clot. This process dissolves the clot and help restore blood flow to the tissue. The key therapeutic strategy here is to activate plasminogen quickly when someone has heart attack or stroke. Now, there are three main types that are used clinically. The first is tissue plasminogen activator or TPA. This is the naturally occurring enzyme in the human. Tissue plasminogen activator cleaves plasminogen to form active plasmin. What's interesting is that modern tissue plasminogen activator used in hospital is now manufactured using recombinant DNA technology. So we can say literally it is produced in laboratory using genetic engineering. Now here is an important clinical consideration. The recombinant form of tissue plasminogen activator is called alteplase. This drug is used to treat heart attack and cerebral thrombosis, that is the blood clot in the brain causing stroke. Alteplase breaks down the clot effectively. The second activator is urokinase. As the name suggests, urokinase is found in normal urine. This also activates plasminogen into plasmin. And the third is streptokinase. This one is interesting because it's derived from hemolytic streptococcus bacteria. Streptokinase forms a complex with plasminogen, and this complex then releases active plasmin. Moving to another fascinating application, enzymes in cancer therapy. Specifically, let's talk about an enzyme called asparginase. To understand how asparginase works, we need to understand a vulnerability that some cancer cells have. Most normal cells in the body can synthesize a non-essential amino acid called aspargine or ASN. However, some tumor cells, particularly certain type of leukemia cells, cannot synthesize aspargine. So, they must depend on getting aspargine from the blood. This is where asparginase comes in as a brilliant therapeutic strategy. Asparginase is an enzyme that hydrolyzes aspargine, meaning it breaks down aspargine into aspartate. When we give asparginase as a drug, it depletes aspargine from the blood. Normal cells can survive this because they can make their own aspargine, but tumor cells that depend on external aspargine cannot get what they need. This suppresses tumor growth. Essentially, we are starving the cancer cells of a nutrient they desperately need. Clinically, asparginase is used to treat acute lymphoblastic leukemia in combination with other drugs. Now let's discuss another important application, enzyme replacement therapy for inborn error of metabolism. These inborn error of metabolism are genetic disorders where a person is born with a specific enzyme which is either defective or absent. So, what is enzyme replacement therapy? It's the therapeutic administration of a functional enzyme to compensate for genetically defective or absent enzyme in the body. Let's look at a specific example. Severe combined immunodeficiency disorder or SCID. In this condition, the deficient enzyme is adenosine deaminase or ADA. Without this enzyme, the immune system does not work properly, leaving the patient extremely vulnerable to infection. Now, the straightforward approach would be to simply inject adenosine deaminase enzyme into the patient. However, this creates two major problems. First, injecting a protein enzyme can cause an immune reaction. The body might recognize it as a foreign and attack it. And second, enzyme has a shorter half-life, meaning it gets broken down quickly in the body. So the treatment doesn't last long and frequent injection would be needed. To solve this problem, scientists developed something called pegylated enzyme. Here, PEG means polyethylene glycol. So pegylation means attaching polyethylene glycol to the enzyme. This modification gives the enzyme a much longer half-life in the body. It stays active for much longer. These pegylated enzymes are now produced using recombinant DNA technology. For adenosine deaminase deficiency, pegylated adenosine deaminase is available, which is available by name elapegadamase, which is marketed under the trade name Revcov. This replaces the missing adenosine deaminase enzyme and allows a patient with a severe combined immunodeficiency disorder to develop a better immune function and live healthier lives. Another practical application of enzyme replacement is for digestive enzymes. The pancreas produces several important digestive enzymes, and when the pancreas is damaged, food digestion becomes impaired. The pancreas secretes three main types of digestive enzymes: amylase for breaking down carbohydrate, lipase for breaking down fats, and proteases for breaking down proteins. When these enzymes are deficient, which happens in various pancreatic disease, the most notable symptom is steatorrhea. This is a condition where there is excessive fat in the stool because lipase is not available to digest dietary fats properly. What causes pancreatic enzyme deficiency? There are three main causes. First is pancreatitis, that is inflammation of the pancreas that damages the enzyme producing cells. Second is cystic fibrosis, which is a genetic disease that affects multiple organs including the pancreas, which causes blockage of the duct that carry digestive enzyme. And third is pancreatectomy, that is the surgical removal of part or all of the pancreas, and usually due to cancer or severe diseases. Fortunately, these digestive enzymes, amylase, lipase, and proteases, are commercially available as a pharmaceutical preparation. They can be taken orally as a replacement therapy to help a patient digest their food properly. By this, it significantly improves the quality of life as well as nutritional status. Finally, let's discuss local use of enzymes. Situations where enzymes are applied directly at a specific site in the body rather than systematically. A good example is hyaluronidase. This enzyme degrades hyaluronic acid, which is a component of the extracellular matrix. It is the material that holds cell together. Interestingly, some bacteria like streptococci naturally produce hyaluronidase to help them spread through the tissues. This property has been harnessed for medical use. Hyaluronidase is now available commercially and has two main local uses. First, it's used to enhance the absorption of local anesthetics. When local anesthetic is injected, adding hyaluronidase helps it spread through the tissue more effectively by breaking down the hyaluronic acid barrier. And second, it's used to enhance the absorption of fluids given subcutaneously, particularly in infants. When fluid needs to be given subcutaneously rather than intravenously, hyaluronidase helps those fluids spread and get absorbed more efficiently into the bloodstream. So let's quickly recap what we learned today. Enzymes are incredibly versatile therapeutic agents with multiple clinical applications. First, thrombolytic enzymes like tissue plasminogen activator, urokinase, and streptokinase dissolves the blood clot by activating plasminogen to plasmin and saving lives in heart attack and strokes. Second, asperginase treats certain cancer by depleting aspergine that tumor cells depend on. Third, enzyme replacement therapy for inborn error of metabolism to replace missing enzyme in genetic disorders like adenosine deaminase deficiency. Fourth, pancreatic enzyme supplements help a patient with pancreatic disease digest their food. And finally, hyaluronidase enhances local absorption of drugs and fluids. This shows how understanding enzyme biochemistry translates directly into saving lives and improving patient care. These are not just theoretical concepts, they are the practical medical tools used every day in hospitals around the world. So that's all for this video. If this was helpful, please like this video, subscribe to the channel for more biochemistry content, and let me know in the comments which therapeutic enzyme application you found most interesting. Thanks for learning with me today, and I will see you in the next video.